Okay, thank you. When I learned that Jan Kolbusch was not available to present, I decided to fill in based on a question I received earlier about use of probiotics for children. So hopefully whoever was interested in that is here. This is a topic that I'm very interested in and passionate about. I have 3 little children at home, and I just really enjoy children and am moved by how much suffering there is in the world by children. So I started to look into this subject many years ago when I learned a fact that millions of children die every year in this world because of a lack of access to potable drinking water. And as I went a little deeper into the subject, I found that the thing that's killing these children is actually diarrhea, and they're dying from dehydration for the most part. And this is because they get microbes from non-potable drinking water, and those microbes get into their digestive system, and they get severe cases of diarrhea and die from dehydration. So I'm really happy to see that in the scientific literature there's a lot of new information coming out, a lot of research being published about the importance and the benefits of probiotics for children. Here are a few. These are things we've covered quite a bit over the last couple of days. Managing lactose intolerance, antibiotic-associated diarrhea and infectious diarrhea, decrease in constipation, decreased risk of necrotizing enterocolitis in premature infants, decrease of cavities, treatment of Helicobacter pylori infections which cause ulcers, treatment of urinary tract infections, decrease in colic, decreased risk of developing eczema, decrease upper respiratory tract infections. These are all proven results from scientific literature specifically for children in pediatrics. So even though in the interest of time I'm not going to go into the details here, but again, antibiotic-associated diarrhea being reduced in children when taking probiotics. I will say that pediatrics, the doctors for children, recommend 2 to 4 weeks of probiotics for all kids who receive an antibiotic prescription. And for any of you who have kids, they are little breeding grounds. At school, they pick up all kinds of things and bring them home in terms of colds and bad bugs. So they do get prescribed antibiotics quite a bit by the medical profession, and so it's very important to give them probiotics so that they don't get out of balance and get more severe problems. Someone was asking earlier about infants. This is a study, actually it was 9 studies on children from 1 to 36 months old, and again, significant reduction in diarrhea with probiotics. So I thought this was noteworthy, this conclusion from one study, that probiotics upregulate local and system immunity, increase anti-inflammatory cytokines and gut impermeability to bacteria and toxins, and suppress pathogens. The anti-inflammatory function of microorganisms. Some of our presenters, Dr. Nadell presented that it is very complex and difficult to understand these microbial communities, and so they're in their laboratory. They're working with trying to grow cultures in glass so they can see what's going on, and growing them in, I think he said, transparent worms. so they could see what's going on. There is really so little known about what actually happens in our digestive system or the digestive system of an animal. But one thing is really clear is that somehow probiotics are stimulating the immune system, and they're stimulating an anti-inflammatory response, so reducing inflammation. So these are my kids, and we used probiotics from the beginning. The first day they were born, we used essential probiotics. And one of the things that you find with kids is they get all kinds of rashes, especially if you use diapers. And taking essential probiotics and applying it topically to any redness, it's amazing how quickly the redness or the inflammation goes away. And definitely with a child that has, an infant who has diaper rash, they cry and scream when it's painful and hurts, and applying essential probiotics within seconds, they will stop the crying. So you can tell, and of course you can visibly see. The other one that's interesting is pink eye. There are certain types of pink eye. It's a bacterial infection in the eye. Also, there are viral infections that cause irritation in the eye. If it is a bacterial infection, we apply essential probiotics diluted in water directly to the eye. It's like a rinse. You just rinse the eye. And again, one of the painful things about pink eye is the inflammation. The eye gets all swollen, it gets red, and it hurts. And it's amazing how the essential probiotics applied topically reduces that pain, that swelling and itching very, very quickly within minutes. The other one, the bottom one here, upset stomach. I mean, it's my children. If one of them has a belly ache, they'll ask for the probiotics. And again, not every time, but I'd say 8 times out of 10, when they've got a stomach ache and they ask for probiotics, and we just give them a little teaspoon, and within minutes, or maybe 10, 20 minutes, that stomach ache goes away, it settles down. Also with nausea in pregnant women, I have many friends and family that they carry around probiotics in their purse because it really does make that nausea go away. So this is a little bit of research about colic. Colic is just the incessant crying of a baby, and it's really unknown. They're crying probably because they're in pain, but it's not really known and why. A lot of times it occurs along with flatulence or gas production in their digestive system. And this was a very interesting study showing a significant reduction in the amount of time spent crying by a child diagnosed with colic with and without probiotics. Of course, we also mentioned earlier no adverse side effects reported. So that's one of the things that there's really very little evidence that or no evidence that probiotics cause negative side effects, and so therefore, a lot of times, it's my philosophy is it doesn't hurt to try. So it might help. It doesn't always help. It's not a silver bullet by any means, but if it may help, and so why not try? Because it certainly won't hurt. Now this is very interesting. This is a study on probiotic supplements used by pregnant women. And these are pregnant women who have a history of some sort of dermatitis like eczema in their family. And so what they studied was the pregnant women taking probiotics and what was the incidence of dermatitis in their children. and there was a significant reduction in the incidence of things like eczema in children where the mothers had taken probiotics during pregnancy. This is about, again, allergies and especially, again, antibiotics. Oh, okay, so this study was about actually children being prescribed antibiotics, which is an indication of how much they get sick, how healthy they are. So with over a 2-year period with children who the mothers took probiotics, they found that the babies that were born from these mothers had less antibiotics prescribed over that period of time. So now I want to announce a program. One of the things that really has struck me is, again, as I mentioned, how many children around the world suffer from basically infections in their digestive system, and this really comes from a lack of access to potable drinking water. So I asked myself, you know, what is if they don't have access to potable drinking water, it must be that the cost of putting in appropriate water treatment systems and, you know, in these areas is too high. So we're going to do our part, a little part, and that is we're going to give a percentage of total production of our products to children who are from poor children in underserved parts of the world. And our theory and strategy is that by getting probiotics to children, we can somehow reduce the incidence of disease and death that these children suffer from. So we plan to partner with, we haven't found the organizations. This is a brand new, first time it's being announced publicly, but we're going to donate essential probiotics, and we're looking for organizations. So if any of you know of organizations that work with and treat or serve poor children anywhere in the world, and believe me, we have plenty of poor children in the United States too. It doesn't have to be necessarily a developing country, but like a lot of aid organizations have lunch programs. So kids that go to school and don't get good nutrition at home, don't have enough food at home, these aid programs are delivering nutrition through a free lunch program. So we're looking for a partner or multiple partners that can work with us, that we can train and educate on how to get these probiotics to kids through their lunch programs. Yeah. So like I said, definitely follow up with us if you know any of these organizations or want to volunteer or help us in this effort. And what we have right now is we have 3.2 million doses of probiotic products for children ready to be deployed. So look forward to doing that, and then at our next conference reporting back on those results. So thank you very much.
Thank you very much.